Hello guys, I'm Arthur Parks and I'm a Pinoy nurse working here in the United States. I work in the emergency room and I'm in the state of Indiana. So I'm gonna give you guys an update on what it's like working now in the middle of the pandemic, the coronavirus. So there are a lot of things that we do differently right now. First, no one is allowed to enter like visitors wise. Unlike before, normally if it's flu season, we're only allowing like one visitor at a time. But now, completely bawal ang visitors sa emergency room, not unless if it's, say for example, a pediatric patient or a patient who is really confused, altered mental status of some sort, and if they are dying, like end of life, na gano'n na, at least yung bibigyan namin sila ng opportunity to be with their loved one. But other than that, there's strict like no policy, no visitor policy in the emergency room. And it's kind of difficult when you're trying to explain that to the relatives. Because normally sa triage, they'll go ahead and talk to the patient, know their main concern, and then at the same time, may mga relative na doon. So, as much as possible, we're really trying to limit dun pa lang. Kasi pagpasok nyo na sa hospital, there are like additional personnel na naka-standby sa harap ng emergency room before they even enter the triage or the waiting room. They will be tested. They will be asked some questions like, have you been in contact with someone who got tested positive, or if they have a fever, cough and cold within the past few days, and someone will take their temperature. So yun yung parang initial screening namin, and then we'll have another screening dun sa actual triage. So far, everyone has been cooperating, but at the same time, there will be like incident na people will get really upset because they wanted to be with their loved one dun sa emergency room, and really have a very, very strong policy na kailangan namin sundin with that, just to protect ourselves, to protect the other patients that were inside. So we are doing this protocol. Second, PPEs, or the personal protective equipment. Wala pa namang scarcity sa pinagtatrabahuhan ko. But as much as possible, we're trying to conserve yung mga PPEs. So you'll go ahead and get one N95 by the start of your shift. And then we have face shields, goggles, because I'm wearing glasses. And then sa lahat naman ng kunyari possible COVID patients namin, we have yung gowns that you can replace. Then we have those rooms na for isolation. So I feel that the hospital is really protecting us. You have an option to wear surgical mask all the time. I mean, it's up to you. I normally do that, surgical mask, and if I know that this patient is presenting those symptoms like fever, cough, shortness of breath, then I will immediately wear my N95 mask. Just make sure that, especially the face shield, just wipe it. And then they're also giving us paper bags. So brown paper bag, you just need to place it in a brown paper bag. Because apparently if you place it on a plastic, mas rapidly na mag-grow yung mga bacteria. So kailangan mahanginan siya. Another thing is cleaning the room. As an emergency room nurse, you need to make sure that all of your equipments are clean. But if it's a COVID positive patient, we need special like cleaning material for that. So tatawagan namin yung housekeeping, and then they'll have a certain protocol on how to clean it. Normally 30 minutes after umalis ng patient, lilinisin nila yun with some disinfectant, and then we need to keep the room like free for another 30 minutes or 1 hour. So we have a special procedure for that. We're also having a daily meeting before the shift because CDC's guidelines are changing like rapidly. Iba yung policy nyo now, iba yung policy nyo kinabukasan, but it's changing para mas paprotektahan kayo of some sort. Like say for example, iba yung policy before kung paano yung isa-submit yung mga swabs, iba na yung policy right now. So we have a different checklist. Like say for example, cough and cold, fever, and if they will be admitted, then we need to make sure that the result will be turned over faster, like in a matter of 10 hours dapat meron na kayong result in order for us to isolate the patients. Another thing is our hospital created like a separate wing for COVID patients. So they created and free another floor na paglalagyan lang ng mga COVID patients. So pretty much our hospital is really trying hard to prepare. I'm very thankful na we're not being hit as bad as Illinois and New York. I'm very thankful that things are not as bad as yung na-experience nila right now sa New York and ibang states. Here in Indiana, we tested a total of like 14,000 people, and out of which I think the 2,200 came out positive, and we have I think a total of 49 deaths sa buong Indiana. But in our county alone, I think we only had one death, and this is as of today, March 30th. So yun, medyo thankful, and at the same time we're really preparing dun sa possibility na magkakaroon talaga ng surge ng patients going to the emergency room. I guess it's a little bit different here because people are listening. I guess a lot of them are really staying at their home. Business, non-essential businesses are canceled for more than a week now. So ang mga bukas lang right now is groceries, restaurants, but you can only order takeout or delivery. Gatherings are being canceled. So parang technically quarantine din, but not as strict dun sa Pilipinas na may mga checkpoints. So wala pa namang ganun. But we also see like a decrease ng mga pumupunta sa emergency room. So people are getting aware that when they go to the emergency room, they're risking their exposure, which is true. So we don't, although meron pa rin mga pumupunta, yung mga nakikiosyoso lang sa ER, but our census really dropped. Like yung mga dental pains, yung mga ganun, yung mga not really emergency cases. So that's one good thing na nakikita namin. At least people are being aware of possible exposures that they will get when they go to the emergency room. Mas nakakatakot yung uncertainty na meron right now because you don't know how long this is gonna last. You don't know pagbalik mo ba sa hospital, sobrang dami yun ng pasyente. But for the most part, we are prepared. We've been dealing with a lot of communicable diseases, so we know and how to protect ourselves. Pero yun nga, iba kasi when it comes to the emergency, because sometimes if the patients are, getting critical, minsan hindi mo na naiisip na kailangan mo protektahan yung sarili mo kasi kailangan mo protektahan yung pasyente. Like say for example, there were like incidents before na patient is not really a positive COVID, but we're trying to rule it out, and then the patient started projectile vomiting. So your initial reaction is just go to the room and then making sure that the patient is not gonna choke, without you realizing na, oh, nakalimutan kong suot yung mask or yung face shield and all. So I actually read an article about there's no emergency in pandemic. You always need to make sure to protect yourself kasi as a frontline healthcare worker, hindi lang yung sarili mo i-infect mo, but you can pass the infection on another patient, family member. So yun yung medyo nakakatakot right now. Again, it's the uncertainty na am I gonna get a fever within the next few days? You know you're protecting yourself, but you're kind of exposed every time that you're working in the emergency room. I guess yun yung medyo critical part na parang binubuwis nyo talaga yung buhay niyo when other people are staying at their home. That's the reality. This is what we signed up for, and I'm proud doing this job. I'm proud helping people right now when everything else is uncertain, while frontline healthcare workers are going to work, risking our lives every day. Possibility of you getting infected. Lalo na ngayon, marami kang nababasa na marami ding nagkakasakit ng mga healthcare provider, may mga namamatay ng mga nurses, mga doktor. So, it is really a tough time to become a nurse. But I love what I do. I love, taking care of people. I'm passionate on what I do. So I'm hoping that this is gonna be over soon. We wanted to get back into our routine. I mean, doing normal stuff. So people just cooperate. Just stay in your home, do hand washing, cover your mouth if you're going to sneeze. So again, guys, thank you so much for watching my channel. Please subscribe and give this video a thumbs up. You guys, and stay safe.